Let's talk about probiotics. These amazing bacteria can be what you really need to improve your kidney health. Fact: almost every single kidney disease patient will have digestive problems at some point. Solving them will greatly help in your battle to lower your creatinine levels. And yes, getting probiotics from foods, supplements, and home remedies is a great way to do this. My name is Catherine and I've been working with kidney disease patients for 7 years. I've seen people getting back their kidney function with an improved diet and lifestyle. And obviously, after getting informed about the best treatments for their condition. This is why I'm here today, to help you improving your kidney health. And if you are new here on Double O Kidney, subscribe now and click the notification bell so you're not missing my updates. Now, probiotics seem to be the talk of the day in the kidney disease community, and with good reason. You can actually use them to improve your kidney health. I keep getting comments asking me, will probiotic supplements help me repair my kidneys? Which brand should I buy? Are prebiotics better than probiotics? And a lot of you are asking about Renadyl. Is it really the magic pill to stop kidney disease? So, today I'll give you the answer you need, and I'll compare the various probiotic supplements to see which one is the best for you. Yes, really a lot to talk about today. Can't wait to start. Just the usual disclaimer before I start. Probiotics are usually safe, but you should still talk to your doctor before adding anything new to your dietary regimen if you have kidney disease. Now, the very first thing you should know about probiotics is, do they actually work? Well, to answer this question, we have to look at the science behind them, because that's the only way to know if something works, alright? And several studies have been made on probiotics for kidney patients, and this is important. It's already a good sign because it means scientists think this works. And they were already able to prove that probiotic supplements are beneficial in the reduction of urea in patients with non-dialysis chronic kidney disease. So there are large studies conducted on people with kidney disease showing us that probiotics can lower your urea nitrogen or BUN in your lab values. This is really important because urea is an indicator of kidney function. Urea nitrogen is a normal waste product in your blood that comes from the breakdown of protein from the foods you eat and from your body metabolism. It is normally removed from your blood by your kidneys, but when kidney function slows down, the BUN level rises. Now, the patients tested in this study on probiotics were found to have lower levels of urea, meaning that their body was able to process uremic toxins better, reducing the workload on the kidneys. Okay, if this is not enough for you, also consider that probiotics will help you if you have an altered gut flora. Now, unfortunately, people with CKD have altered gut flora almost constantly. This is not news. Kidney disease alone can mess up your gut flora. And then we have to add the prescription drugs and therapies all kidney patients have to follow. So let's just say that it is becoming more widely accepted that people with CKD have altered gut flora. This is not good for your kidney health, and it will also cause constipation or diarrhea. Not to consider that it will decrease your body's ability to absorb nutrients, and your kidneys need those nutrients. And also consider that there are studies suggesting that probiotics can help lowering blood sugar too. So there is one more reason to consider adding some probiotics to your diet. And what about inflammation? This is really important. Having less inflammation, less waste products in the body, and less blood glucose in diabetics are all great ways to help your kidney health. Yes, probiotics can help with all these issues. Now, many of these benefits are not just good for kidney disease patients. So if you know anyone who may benefit from a healthier way of eating, send them this video. And with all these benefits in mind, let's try to understand how to get enough of this good stuff to get the job done, shall we? Because supplements aren't the only way to improve your gut health and your kidney health. There is food too. So let's see what foods you should consider. There are several foods that are good sources of probiotics, and some of them are suitable for a renal diet, starting from yogurt. Now, this food is not usually recommended for kidney disease patients. I'm still showing you this because it's the very first thing that comes to mind when talking about probiotics. Also, if you can fit in the added phosphorus in your diet, yogurt could still be beneficial for you. But choose brands that specify the presence of probiotics on the label, because not all yogurts have live strains that provide benefits. But also consider that most of the benefits I've shown you earlier were found by studies administering patients dosages of 1 billion to 100 billion live organisms, or colony-forming units, CFU in short, per day. 1 billion to 100 billion CFUs per day, okay? Keep this in mind. CFU stands for colony-forming unit, which simply refers to the number of live and active microorganisms that can be found in foods or supplements. Now, yogurt brands only need 1 billion CFUs in a single yogurt to put the probiotic label on their products, alright? Some brands can have more, but don't assume it unless they can write on the label how many CFUs the yogurt contains. Now, kefir is a lot better than yogurt. It's a fermented milk drink made from kefir grains and milk. Kefir usually has more probiotics in it, about 25 to 30 billion per serving. Kefir, unlike yogurt, contains several major strains of friendly bacteria and yeast, making it a diverse and potent probiotic. It is also low in lactose and most of all in phosphorus and potassium. Just 105 milligrams per 100 grams, or less than half cup. And just 164 milligrams of potassium. Kefir was studied recently. Researchers found out that it can actually reduce kidney inflammation. But be sure to choose the unpasteurized kind. The pasteurizing process, which is used to treat most supermarket brands, kills active good bacteria. So if you find a good brand of kefir, you can just add it to your diet and skip the supplements part of this video. But I wouldn't recommend you to do that. There are still a couple of things worth knowing about probiotic supplements. Now, another food worth considering is sauerkraut. Sauerkraut is loaded with many healthy vitamins that can help you improve your nutritional status. And I know this is a fairly unusual food to recommend, but it has some major health benefits we should consider. Sauerkraut is a type of fermented cabbage, okay? Due to the fermentation it undergoes, sauerkraut offers nutrition and health benefits far beyond those of fresh cabbage, especially because it can have up to 1 billion CFUs of probiotics per single gram. Okay, not all the preparations can reach this quantity. There are many brands and it's hard to tell how many CFUs there are actually going to be in the product, but sauerkraut can have up 28 distinct bacterial strains, and that's a very good thing, since consuming a wide variety of strain may give you a broader range of health benefits. But you want to find sauerkraut that's been handled with care and not processed, okay? And it may be worth it. Sauerkraut has just 241 milligrams of potassium per cup and 23 milligrams of phosphorus. And that's really great because you're not going to need a whole cup of it to get the benefits. You're going to need a small serving of it. Now, if you want to try sauerkraut, you should be aware that it's a bit high in sodium. So, first of all, find low sodium sauerkraut, which contains only 437 milligrams per cup. Again, not a lot since you're not going to eat a whole cup. And drain all the brine liquid from the cabbage and rinse it to further reduce the sodium content. And there are some other options of foods rich in probiotics like tempeh. Made from a base of fermented soybeans, this Indonesian patty makes a type of natural antibiotic that fights bad bacteria. But tempeh is also high in protein. Then there is miso soup, a popular breakfast food in Japan made from fermented soybean, and kombucha, a fermented tea. And even pickles are rich in probiotics. Okay, not all these foods are going to be accessible or even palatable for everyone, and many of them are too high in phosphorus or sodium. But in my opinion, you should at least consider adding kefir and sauerkraut to your diet. You will get a lot of benefits without the need for pills, and they're both suitable for a kidney diet. But if you don't want to go through the struggle of finding brands that don't process their foods, you can still use supplements. Now, supplements are considered the best way to add probiotics to your renal diet by many dietitians, mainly because you will know exactly how many CFUs you are going to get and from what strains of bacteria. Most of the studies I've cited were using dosages of 1 billion to 100 billion CFUs, okay? And they were using supplements. Now, searching for probiotic supplements on Amazon.com, we can find several brands with 10 to 20 different strains of probiotics and up to 100 billion CFUs. Some supplements also have prebiotics in them. While probiotics are the good bacteria present in your gut, prebiotics are foods that feed these bacteria, alright? So it may be a good idea to add them to probiotics. You can find prebiotics naturally in things like asparagus, Jerusalem artichokes, but also oatmeal and red wine, or in supplements. Now, I'm not going to focus on prebiotics because the scientific literature all points in the direction of probiotics being responsible for the health benefits you want. So, let's see what probiotic supplements you should get. Now, if we search on Amazon.com for probiotics, there are several affirmed brands with thousands of reviews from customers. Prices as low as $12 per bottle of 60 capsules. And if you want to make an informed choice, we should take a look at the strains of probiotics present in supplements and foods. Yogurt, for example, has 3 or 4 different probiotic strains. Remember that each strain may have different benefits, and the more, the better. So in yogurt, you will find usually a couple of strains of lactobacillus and maybe one of streptococcus. In kefir, you're going to find much more concentration of these probiotics, varying from approximately 1 million to 1 billion of CFU per milliliter, and also more strains up to 10. But these are foods, so they are not going to list what strains you can find on the labels. It's totally different with supplements. Like Renadyl, a supplement specifically made for kidney patients. Now, I'll show you what the best supplements are and I'll confront them with Renadyl in a moment. Let's discuss safety and side effects before that. Probiotics are generally safe, okay? Again, this is not a prescription drug, it's just food and supplements. These good bacteria already exist in the body, but there could be side effects. The most common side effects are a temporary increase in gas, bloating, constipation, and thirst. Some people can also react poorly to ingredients used in probiotic supplements or in probiotic foods. A good way to minimize potential side effects is to start with a low dose of probiotics and slowly increase to the full dosage over a few weeks. And again, ask your doctor before adding probiotic foods and supplements to your dietary regimen, okay? So, what are the best brands you can find? Let's see in the next slide. Okay. These are the labels of two brands you can find on Amazon and the label of Renadyl. I've already talked about Renadyl in my previous videos and it's an interesting supplement in my opinion. It's made for kidney disease patients and that's great. I mean, it was about time someone would start making supplements to help people suffering from kidney disease. And according to the manufacturer, the 3 strains of probiotics present in it are going to specifically target uremic toxins, okay? These are the wastes your kidneys cannot remove. So this is going to reduce the burden on the kidneys. Okay, if we take a closer look, what they put in Renadyl is Streptococcus thermophilus, Lactobacillus acidophilus, and Bifidobacterium longum. This is their proprietary blend, but you can actually find the same strains and more in many of the brands of probiotic supplements you can find on Amazon.com. Like these two I'm showing you here from Now Supplements and New Rhythm. But they also have other strains with other benefits, and in New Rhythm there's also a source of prebiotics. Now, the other difference is that Renadyl is going to charge you $170 for 150 capsules, while the less expensive supplements on Amazon are going to cost about $30 to $40 for 150 capsules. And I get it, the biotech company selling Renadyl researched it on kidney disease patients, and this is good, but I want to see a lot more than this to recommend it. I mean, the only third-party study done on Renadyl was done on 30 subjects, okay? And it was just able to prove that Renadyl wasn't going to cause more side effects than any other probiotic supplements. On the other hand, the studies I cited in the first part of the video were done on brands of probiotic supplements that were available before Renadyl was even a thing. So, Renadyl is not going to be the magic pill to end kidney disease, but it's still great. They're making supplements for kidney patients, don't get me wrong. And this is just my opinion. Get the supplement you can find. Don't bother get something cheap from the other side of the world. Check the label, verify that it has at least 10 strains of probiotics and a reasonable number of CFUs per pill and start from there. And also get probiotics from food if you can, because food is always the best medicine. So, in conclusion, probiotics may be a really good aid in retarding the progression of CKD. This is because they can reduce the gut-derived nephrotoxic substances present in the body and also reduce the inflammation, giving the kidneys the chance to improve. It's clear in my opinion that these beneficial bacteria can do more than just enhance your gut health. But I must say that researchers still haven't proven a significant reduction of creatinine levels associated with probiotics. But probiotics can definitely help, okay? Especially if as part of a good treatment plan, which includes a valid renal diet and a healthy lifestyle. When you have better digestion, less inflammation and gastrointestinal problems, you will feel better and you will be able to do everything better, even improve your kidney health. So keep getting informed about what really matters in beating chronic kidney disease and keep watching my videos here on Double O Kidney. This is all for today. I hope you enjoyed this video and God bless you.